All right. Good morning, everybody. This is Dee Reinhardt with Illinois WorkNet. We are going to be starting our DHS Technical Assistance call. Welcome, everybody. And where I am, it's kind of bleh, but hopefully the sun will be out later today and we'll be in good shape. Today we've got a big agenda, and then we've got some introductions that we're going to be making from some of the CBOs that we have working with us in the system. So let's get this party started so that we can get everything done within a decent amount of time. So what I want to do right now is go down the agenda, and what we talked about last week is we want to review what happens if a customer misses an orientation and they are in a mandatory area. So what I have right here, and we'll get this out in the follow-up email that Olivia G. sends out to everybody, and we want to make sure that you're working with this process. And this was reviewed and vetted by our 3 leaders in Region 1. Yes, ma'am. Good morning. We had this reviewed by our leaders in Region 1 and kind of passed it by the other regions that have some mandatory participants. So if we need to modify this just a little bit for the downstate regions, we can do that. But we want this process to be as consistent as possible across the state. So if the customer does not attend, and let me get into a customer who missed orientation, and I'll do this in test. All right, I'm going to cover up the chat pod here for just a couple of minutes so that I can make my screen share a little bit bigger. All right, and let's make this a titch bigger on the screen. Okay, so if you have a customer who missed orientation, look, Celeste is a test customer, and they don't show up on the intake activities. What you will do is you will say, which is this default answer, has not attended orientation, conciliation process has started. Then what you would do is you would scroll down here to scheduled for follow-up / consent meeting, and you would put the date of the next orientation session that you're going to invite them to that will be the conciliation appointment. So you're going to send them a 2846G and invite them to an actual orientation day. So if you've got some slots available on the date for maybe, say, September 29th, you would pick that September 29th date. Now, right now, these follow-up appointments are not set up for the invitation process, and we probably will not set them up for the orientation process. So you, in your office, will have to determine, are you going to send the conciliations for the morning or the afternoon session? And then just note that in a case note here that you would say sent, is it 2846G for 9/29 morning session. And then you can save that as a case note. You don't have to send that to anybody. And then add that case note. So then what you need to do is, if that customer misses the conciliation appointment, the sanction process will begin. And if they don't show up there, you've got everything documented here. Wording on the initial 1721 should indicate you are a mandatory participant and required to attend this appointment for engagement in a work and training activity. So we will include this language that's in this notepad in the follow-up notes that we send out so that you have all of this information exactly so that you know what to do with this. All right, so I'm going to move this over out of the way, and I'm going to minimize my screen. And next we want to talk about the dashboard. So Olivia, if you want to start sharing your screen, I'm going to leave mine going so that we can talk about the live dashboard.
All righty. Okay, so I'm just going to go over the intake dashboard really quick. It looks beautiful this week. Dee might have been in contact with a lot of you. She's been working really hard this week getting it all cleaned up and making sure everything looks good, and it really looks great. So the areas, just to go over the areas to keep an eye on, are if your customer's profile information needs finished, which we don't currently have anybody in that area, so that's great. And then we also have ready for review by DHS caseworker. We have 29 people in that area. This is the only one that we still have quite a few customers in that we need to move out. Dee, correct me if I'm wrong, but I believe Deidre may be reaching out and working with some of you guys to clean these up.
Yes, Deidre, Aurelia, and Lisa, we're going to be working on that list.
Okay, so you may be getting a call or getting in contact with one of them here soon if you have any customers in this area. And then our consent area looks beautiful. We only have 7 people and then needs to be scheduled for consent. 5 of those we know where they need to go, and we'll have them cleaned up soon. And then we have some missed consent meetings. If customers are missing their missed consent meetings and they need to go through conciliation or something like that, we just need to make sure we're marking that on the page so we know what's going on with them and not just leaving them.
Olivia, the 18 people that are in that list, I know that they're there. They are all older customers, and I set a consent meeting appointment for Wednesday the 21st, and I established a case note for each of those customers and copied the staff person from that area, so you need to check your emails. Go in there. I know that there are some from Region 5. There are some from Region, I don't want Olivia to click on these, so what I'm going to do is I'm going to go into my dashboard so that I can tell you where these areas are. You should have gotten a message if you are in those areas to go in and clean these people up, and all you have to do is mark them as missed consent meeting, and it will move them into that red line. Olivia, if you want to point to it where it says did not attend consent meeting, and that's then it's up to you to determine whether or not you are going to move forward with a conciliation appointment or a sanction. And we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 people in that list of 18 are from the FCRC in East St. Louis. We have 1, 2, 3 from Decatur, 1 from Benton, and 1 from Mid-South. So if I mentioned your FCRC, I need you to go into that list and clean those up today, please. Okay, and then go ahead, Olivia.
That's really all I had for the dashboard. Just keep an eye on those areas and just know that Dee and Deidre are going to be reaching out to you guys to clean those up. And it looks great. It's a very beautiful dashboard as of right now. So If we can, try to keep it cleaned up and not let customers accumulate in any of the yellow areas. It'll really help the process of getting all the customers moved through into CBOs, and it'll be really helpful for the study in general. Do you guys have any questions on any areas in the dashboard or anything? All right, it doesn't look like anybody's typing. So that's all I have for the dashboard, Dee.
Okay. I do want to talk about the intake activities page items again. On the dashboard, I need to minimize your screen, Olivia, and bring mine back up. All right, and here's mine moving. There's some days where these move real easy and other days when they just don't. Okay, so if somebody misses orientation, you have a list of the people who miss orientation. And what we need to do is we need to figure out what are we going to do with those people. And we talked about the fact that if they just flat out miss it, they will have the conciliation process started and what we're going to do with that process. But maybe they attend orientation and they don't want to participate. Many of the people that I found in the lists that I was cleaning up had wonderful case notes. They had, I could follow what was going along and what happened with that customer just by looking at the case notes. But in the actual activities tabs on the page to get them to move through the dashboard, the radio buttons had not been checked. So what we need to do with a customer is if they do attend orientation, then they decline to participate. They just don't want to participate. In a voluntary area, you can't do much more. You just mark that declines to participate. In any mandatory area, they have to do something, employment and training or volunteer work, or there's 3 things that they can do, or they have to be exempt. So what you do is you mark attended orientation and mark this reason here. If they are interested in coming back at a later date, mark that one. If they're interested in coming back and filling out the application process, mark that one. If they're not interested in anything, mark one of these 2 items here. If they are going to come back, then you have to schedule them for a follow-up consent meeting. And then if they don't come to that consent meeting, you start the conciliation process then. What we are working on doing right now is if somebody is exempt, we are going to add another option in here about they are exempt. But in the interim, until we get that added, because we have to get some things done for the CBO process, in the interim, you would mark here, I'm interested in the training but can't participate right now, and then make sure that in the case notes you add a case note that says this customer, oh goodness, I can't type, because why they are exempt, and then follow up in however many months determined by your conversation with them. So then you can add that as a case note. You don't have to send it to anybody. And then add that there, and then mark that they're interested. For right now, if they were an older customer and the morning or afternoon session has not been added, you will have to add that morning or afternoon session there to get it to save. And then you schedule them for a follow-up meeting, and if maybe it's a drug treatment program and they need 3 months, you go to December and schedule them for December 20th. And then save that, and it will move that customer to the right line in the dashboard. Because right now, live, we have way too many people in the missed orientation section. We've got 4,300 people in the missed orientation, and we need to move them somewhere. So if they missed orientation, they need to probably either be re-invited or they need to be in one of these red lines. And Rockford is here to tell you that as soon as the word gets out on the street that people get sanctioned, you'll get, what, a 50% show rate on appointments that are called? Give me a number, Winnebago, about what you've been getting showing up. So this is the way to go, and we hope that we can get this moving a little bit better for everybody. It was really easy in the places where there were case notes, and I appreciate everybody who did write those case notes. It was really easy for me to just check the buttons on the intake activities page and move these people out of the yellow areas. Okay, Winnebago said 40 to 45% show rate, and a lot of you are getting what, maybe 10% show rate? So we need to start being serious about moving these people through and getting the right paperwork done on them. All right, next on, we covered exempt status for if they haven't been assigned. So Olivia, do you want to talk about, how about if I just leave my screen up and you tell me where to drive to, and we talk about the exempt status for a customer who's already been assigned.
Okay, so for customers who have already been assigned and went to the CBO, we are having some CBOs run into situations where their customers are unable to continue on with training due to some type of health issue. Some of them are like they have a surgery coming up and they're not going to be able to participate after surgery, or like a broken leg. Some of them are more chronic. They say that there's no way, they tell them on their first meeting they cannot participate. So we have included an exempt status on the progress page for the customers.
So I need to go to I'll get somebody that's actually enrolled, and we'll go to a progress page.
And so what these CBOs are going to do is they are going to put in a case note saying that these customers have told them they have some kind of a medical issue going on and that they need to go back to DHS to be reevaluated. So these case notes will be sent to you via email and message on WorkNet. And then whenever you do get a customer who comes in and they broke their leg and they needed an exemption from you, you will just go into this customer's progress page and update their SNAP eligibility and select exempt and then click update. And then that way whenever the CBO is going in and doing things with that customer, they will be able to see that their status is now exempt. They're still going to engage the customer as much as they can and have them complete training the aspects that they can complete. And then we also would like you guys to go in and add a case note, just simply saying like, this customer is exempt due to this issue. If it's a temporary exemption, go ahead and say this customer is temporarily exempt due to a broken leg. And if it is a temporary exemption and you know the end of the exemption date, go ahead and include that in the case note as well. So your case note would read, this customer is temporarily exempt due to a broken leg. The exemption end date is 11/02/2016. And then you will send that via WorkNet message and email. And then that way the CBO will have the date in that customer's progress page so they will know whenever they can continue treating them like a regular mandatory customer and engaging them, and the consequences will kick in if they're not showing up for their appointments or something like that.
This is in test, and right now it doesn't say CBO primary contact, but you would mark DHS primary contact and the CBO primary contact.
Yeah, and you would send it to them. And then when that exemption date is up, you can go in and change their status to eligible. The CBO might notice the exemption date is up, and we're going to have them send you a case note just confirming the exemption date is up before they go in and mark them as eligible again. Do you guys have any questions on?
There is a question from Northwest, so that they, is that just for medical or is that for anyone?
You can use this for anyone who is exempt. So there's another question. I noticed this is only on the point of the progress. Can we make this at the point of intake? Yeah, and that's what Dee was mentioning earlier about the intake activities. We're going to talk to Natasha, and me, Dee, and Natasha will talk to the programmers and see if we can get an exemption put in on the eligibility review page, because you also have to notify or put in their status there as well. So that's definitely something we can look into doing.
And that was the whole thing that I was just talking about marking them as interested but unable to participate at this time. So that's where you would have to make the case note about the exemption, and then up until a certain point, we're just going to have to dig through those people for that reason. But after that, hopefully we can add at least a radio button that says exempt, so that if they don't want to be a voluntary participant, then we know why they're not participating. So does that answer your questions, Northwest? Yes, they can. Exempt customers have the ability to be a voluntary EPIC participant. Because if they're over 49, they would be considered exempt, but they can volunteer to participate. Okay, let's move to the next item. Thank you, Natasha. They are not the target population. Okay, let's talk about work registrants. And we did get some definition on where you will find this information. And this is from IES. So let me make this a little bit smaller. We'll send out this language with the follow-up. This was provided by Juanita, and I apologize for not knowing Juanita's last name, but apparently she is the IES expert for the state. And thank you, Mr. Hill, Juanita Sanders. The screenshot shows what you will see after you answer a question in IES. So the question does not say, is the person a work registrant? That question actually says, is there a SNAP unit member potentially subject to the SNAP work requirements? And then if the question is a default yes, so that's where it is 18 to 49, no one in the household under the age of 18. the question will be grayed out until the waiver is ended for SNAP work requirements. So this is the screen that will pop up, and I blanked out the customer information because this was a live screen. So this is the screen that you will see, and if somebody can tell me where it says it on this screen, what line they're looking at where it says yes, then that will help us define this even further. So that's the item about the work registrant, and on the EPIS application, you need to say you need to answer the question, is work registrant yes or no? And so then you would be able to see it from this IES screen. So we'll get the actual spot on this screen for the follow-up on this. All right, next item in the agenda is testing targeted messaging results. What we found out is that many of you are getting some messages that may have been, I forgot what the word is that you guys use, but may have been reassigned to a different kind of job within may have been detailed out to a different kind of job. So what we're going to do is we're going to be sending messages to the DHS primary contact and to a backup, so that in case the primary contact is on vacation or medical leave, then somebody will be able to take action on that customer. All right, and the other thing that we're going to be doing is once IES takes effect across the state for everybody, I believe that is Monday. The DHS case IDs go away, and currently the DHS case IDs are how we tell what office people are from. So we are going to hopefully be able to, by the end of next week, have programmed into the offices where the okay, do we know when? Okay. Okay. So what we will still try to get done, and it may not be as urgent now, is for each pod, we will have the option for you to have a feeder office selection as well. But you will still be assigned by pod to an office. But your customers, you will select the region that you're in, or in many cases, that's the only region that you have, what office you have, and then for Chicago, which feeder office you're going to for the pod. So that's how we are going to deal with that. We'll need to be talking with somebody after this call to find out a little bit more details. Okay. Effective January 1st, and we don't know what's going to really and truly happen with this yet, but we need to start preparing our customers for the potential that the waiver will be eliminated. That at that point on January 1st, this message may be what you need to talk about with your customers. So effective January 1st, 2017, ABODs between 18 and 49 years old may only be eligible to receive SNAP benefits for 3 months within a 36-month period. This is known as a time limit. If they are not engaged in an activity/component, if the state of Illinois does not receive a recommendation to continue the time limit, that will become official policy. So you guys should begin emphasizing this when you're meeting with customers regarding engagement. Tell them that EPIC is a beautiful opportunity for them to get career pathway training rather than just a job. And one way to say this is we don't know what's going to happen effective January 1st at this moment, but this is a great way for you to potentially avoid any hassle. And this was written by Kelly Richards so that we have the proper terms in here. So if you are in a mandatory area, well, actually anywhere across the state, this could become in effect, and we will notify you. Probably you guys will know before we do about whether or not this is truth and moving forward. Okay. Let's move this over. We'll include this in our note that we send out. So I think that's all of the news and updates that we have. I don't see where anybody has marked that they need something answered from us. So we'll give that just a moment just in case you do have some more questions to ask about anything. And then what we're going to do is we're going to start in on our CBO introductions. So I'm looking to see if we have cleanup process you spoke of earlier. I believe that was on the dashboard, Mr. Hill. Is that what you're talking about, the cleanup on the dashboard? Okay, so let me show my screen here again. And Sherlonda, Judith, and Christina, get ready because we're going to open up your microphone so that you'll be able to do your introductions. And so what I did on the dashboard is I went through and I worked on everybody who was in an application status that had not already been cleared up. So we worked on the incomplete application within 24 hours. I cleaned that up. I have questions out on these particular people. And then incomplete applications older than 24 hours. I cleaned out everybody except for these four. There were quite a few in there. And then I went through and I cleaned up needs to be scheduled for consent or missed consent meeting. The 17 people that are in this section are from East St. Louis. I went through where they were from. There was one person from Chicago. There were several from East St. Louis, a couple from Decatur, and I can't remember what the other area was. But those were all older customers that needed to be cleared up. We know where 5 of the 7 people here on the needs to be scheduled for consent need to actually go, and as soon as our programmer has a little bit of time to clean those up, that number will be down to 2. But if we can go through the process for each person right after the orientations, then we won't have big numbers in those yellow areas. Deidre, Areli, and Lisa are going to work on the numbers for the people here that say ready for review by DHS caseworker. And one of them or I will be in touch with everybody who is in that list. So, does that tell you what you needed to know, Mr. Hill? All right, and I see Leslie typing, so we'll wait to see. Sometimes when you're just typing on your computer, it looks like you're typing for the webinar, so when are the consent meetings? The consent meetings are when you schedule them. So this is language from when we still were doing the NOCD appointments, and the consent was they would have to come back after the NOCD and do the random assignment at that point in time. What we could do is change the language and make that just follow-up, but that's what we're using that area for now. Needs to be scheduled is obvious. Missed consent meeting is telling us that somebody actually missed the consent meeting. And then once you actually mark the radio button, it will move them down to did not attend. So based on what happened with that person's profile, they will, if they don't have an application in there, and if something didn't happen with the eligibility review and the random assignment, it will say that they missed their consent meeting if there is a date scheduled in there. You have to physically go in and mark it as they did not attend the consent for them to move down to the red line area. So does that answer your question, Leslie? All right, good. If you need to talk, we can talk after the call. All right, so let's start out with Sear, and let's open up Sherlonda's phone line. Is Sherlonda on the call, and do you need me to share anything?
I am definitely on the call. How are you?
Great. Do you want to tell everybody what SEER stands for?
Yes, it's Service, Employment, and Redevelopment. So the full name of our company is Central State SEER, and we also have other entities like Circo, Inc. as well. So that we have a profit and a nonprofit side to our organization. So I'm pretty much Shalondra Brooks. I'm the program manager of the DHS programs as well as healthcare careers. We're located in Little Village at 3948 West 26th Street. We also have another location for the One Stop, which is in Cicero, Illinois. We currently provide SNAP Job Placement, SNAP Special Project, which is located in Aurora, Illinois, and we also have the Work First program as well. We've had those DHS programs for over 10 years here, just at our Little Village location. Our EPIC design pretty much is healthcare driven because we currently offer a healthcare bridge program, and it's career pathways for patient care technicians. So individuals are CNAs, they go from CNA, phlebotomy to EKG, and then to national credentials. So when they leave, they probably have about 4 credentials in hand. So in less than a year, we can take an individual from a healthcare bridge through all 3 tracks into employment. We've had many successes with the program. We just started adding the career pathways over the last 2 years because we saw that 1, individuals wanted to go far, and 2, there was definitely a need with employers. Is there anything else that I probably didn't cover, Dee?
Do you want to let's hear a little bit about what the customers go through as they're going through your program.
So, as individuals come in for the EPIC program, we schedule them. We reach out to them because once they're in the system and we get them, and if the appointment doesn't align with how they're available once it's in that system, we'll call, contact them and see, hey, if it actually works for them, we keep it. If it doesn't, or if we feel that we want to move it up so that we can kind of engage everyone as a group, we'll move those appointments up. We'll bring them in. They'll get an overview of the program. So we just talk about like what we do, how we do it, what they can expect, and what we expect from them. From that point, they'll start to meet with their case. They meet with their CDS right from the beginning. They'll do assessments. We'll identify, do they have stable housing, any drug, substance abuse issues, and can kind of conduct the necessary referrals up front. just to see how well they'll do with just making sure that they're going to, if they need to go to counseling or if they need to go to GED and things of that nature, just making sure that we're addressing those things before we actually even talk. We don't have the discussion about training, but we also let them know what it would look like if they did these things and how soon we can actually get them in training. Once they complete everything, if they need bridge, we'll assign to bridge. And bridge is just if they're reading below a 6th grade level or reading between 6th grade and 8th grade levels, then we'll assign them to bridge. If they read above that, and some individuals do come in, we've had individuals come in with college degrees and things of that nature. We even had some individuals come in with 1 credential or 2 out of the 3 credentials that we offer. So we'll kind of just slide them into the training to get, so that they can complete the 1 credential that would actually lead to them having a national certification. So it's like either they're gonna have bridge, they're not going to require bridge, and then they can go straight into their training process. The training program. But again, that's a process, and we've only seen that done maybe 3 times with our participants. 1 has a degree, 1 has 2 credentials and not the other, and 1 person has 1 out of the 3 credentials. So it's just where we thought it would be a cohort model, it's actually not, because it's just meeting the participants where they are. So we're thinking at first like we'll get enough individuals, but they're all at different levels, and some of them are just dislocated workers as well.
Great. Thank you for sharing with us. Does anybody from the audience have a question for Sherlonda? All right. I don't see, I do see Northwest typing.
And also just to, we have a training provider that actually works right with us so that we provide on-site case management services to our participants. So we're at the training as they're there. So if they're there Monday and Wednesday, we're actually there Mondays and Wednesdays. And they're located right in our building in Little Village as well.
Great. How are the customers reacting to your program?
I think because we're very upfront in the beginning of the expectations and what we're about and how they can maneuver through the process, they're reacting quite well. Some individuals, I think that we might have had like a few to say, oh, well, this might not be for me, but just letting them know that if they're quitting right now and if they don't have a job and they're not doing something, they'll be in the same position next year. So it's better to get these are services that are offered for free. We'll take care of X, Y, and Z. We'll eliminate the middle person. We'll place you directly into employment. But they have to see the value in your program. They have to see that this makes sense for me. So I think for providers, we have to sell it.
Yeah, exactly. And it helps if DHS knows what you're offering so that they can help sell the whole process to the customer as well.
Absolutely. So they don't have and then we tell them about, like, not only are we paying for the training and we're making sure that we're connecting you to additional resources, but they're getting uniforms, they're getting transportation, they're getting follow-up services because they may lose their job after they've obtained employment. So you want to make sure that they know that they have a support system. The one thing that I've noticed is if they don't feel supported and they don't see value, they're not coming back.
Right. And Northwest is also asking, what are the expectations that you give to the customers? I'm assuming that's what they meant.
We expect that if we set appointments that you keep them, that you arrive on time, that you have a positive attitude, that you're able to communicate openly and honestly about where you are in your life, where you are right now. Is this something that you really want? Can you afford to do this? How much sense does this make for you? So we want to make sure that if we're going to give 100%, that they're going to give it as well. And we actually have them sign something. They sign a participant agreement that if I'm late, I will contact. If I will and they initial and we go over it and we make sure that they clearly understand that these are the things that we're going to hold them accountable to.
And you're trying to instill some workplace skills and ethics in them, or get
Absolutely.
it out of them.
Absolutely. So if they're late, we're addressing that right up front, not, okay, you're late today, oh, whatever. But, no, you're late, and this is unacceptable, and this is why. But there's a way of doing that, just letting them know, I want to make sure you get everything you need. So if we have 30 minutes, a 30-minute appointment, and you're 10 minutes late, you're not getting the services that you need. So just kind of putting it back on them just so that they feel like, oh, wow, I'm cutting my own time short.
Exactly, exactly. That's great. All right. Thank you very much. And I want to give Judith some time to talk today. And Judith is from A Safe Haven. So, Judith, let's open up your microphone.
Hello, my name is Judith Ball. I work for A Safe Haven, located at 2750 West Roosevelt Road in Chicago. We're in the Lawndale neighborhood. The programs that we're offering are the Culinary Arts Job Training Program, and we have the Welding Job Training Program. There are a few additional things that I'm going to be uploading to the website, because we are offering bridge programs to raise TABE scores. We have a minimum requirement for enrollment into our culinary arts program, which is the TABE score of an 8, and in the welding program, a TABE score of a 10.0. Because the reason for this is because we find that our learners actually, when they have the higher TABE scores, they do better in the training program.
Judith, just in case the DHS staff do not know what a TABE is, do you want to let them know briefly?
Yes. A TABE test is a standardized test used in all of our federal contracts with regard to the training. A TABE score is like a general indicator of what approximate grade level that the learner has achieved this far. This is really helpful to us because we've had people coming in through the EPIC program that state to us that they have associate degrees, or they have this or they have that, but then on the other side, they don't TABE very well. It may be just simple as, them being out of school for a while. So then we immediately offer them the bridge program, which allows them to raise their TABE scores so they can get into any of the training programs that they would like.
Great. So you also have some bridge program too, correct?
We do. Then I had mentioned that just a little bit. We have a bridge program, and we also have a GED or high school diploma offered right here on site. At our location, we open up the thing I wanted to mention too, the beauty of A Safe Haven is, for instance, recently I was given a customer who is a homeless individual, and not only can we offer them the job training vocational skills, but we can also offer them interim housing while they're going through this to alleviate some of the pressure of being homeless in Chicago.
Great. What are some of the expectations that you have of your participants?
Again, I'm the same as the last provider mentioned. We have zero tolerance on attendancy. You must be here, you must be on time, and you must be ready to go. We have zero tolerance on attendance in our vocational programs, but with the bridge program, if life shows up while they're attending bridge, then we as long as we know in advance, then we can navigate that system with the learner.
All right. How long is your bridge program?
It depends on the learner. Some people get right back into the swing of things. Every participant must attend at least 40 hours of bridge until they can re-TABE, and that's through ICCB, I believe, the Governing Board over Education here in the state of Illinois.
Which is the Illinois Community College Board.
Yes.
just for everybody else who doesn't know what those letters stand for.
Sorry.
No, that's
I'm
okay.
full of acronyms today.
Yeah, we all are.
And we also do offer other job training programs, like I said, that are not listed. So in addition to the welding and the culinary arts, we also have a landscaping job training program, which usually opens up for enrollments in March. Then we also have housekeeping and customer service job training programs, but these are not credentialed as that we would like. We are seeking credentialing as we speak. More or less, the education department is seeking credentialing for those programs, but minimally, they will all earn the OSHA 10 certification, which will open up doors to career employment.
Do you have them do work experience at the same time, paid work experience at the same time that they're doing classroom training at all?
No, not at the same time. A little bit with the culinary arts, because the things that they teach in culinary arts, like knife skills and measurement and things like that, it's best practice to have the hands-on training. So they do actually, where we have a full-service cafeteria at Safe Haven, because we have over 400, anywhere between 400 and 450 residents who live at this site as well, and that's how we're able to, number one, opening up housing to any of our EPIC participants who do not have housing. With our cafeteria, then the learner in culinary arts gets the actual hands-on skill and the real feel of how a major food-producing kitchen operates, because it's a lot different than when you're cooking at home than when you're cooking in the industry.
Oh, yeah, very definitely. Yeah, you can't lick the spoon and put it back in
Right.
the bowl.
None of that. None of that. Very frowned on.
So they wouldn't do good at my house. Okay. Does anybody else have any questions for, I don't know if Sherlonda's still on the call or not, for either Sherlonda or Judith?
One thing I just wanted to add real quick. Oh, it just went out of my mind. I'm so sorry. Forget it.
That's why I always have to hold a finger up when I need to remember something, so that
Right.
I'm looking at my finger and trying to remember.
Right. That's a good practice. I'm going to put that into play.
When you get old like me, then you have to do these kind of things. All right. I don't see any more questions being typed, and we can't get Asian Human Services. We can't get a rise out of them, so they were going to be our third presenter today.
I also would like to just thank Tammy Stone for our site visit that we had on Wednesday, when she brought in the team for the site visit. She just was magnificent, and I just thank you for the opportunity, and everything went very well.
That's great. We'll pass that on to Tammy. She doesn't happen to be on the call today.
Okay.
So, but thank you very much, and thank you for sharing, and thank you, Sherlonda, for sharing about SEER. And we will hopefully catch up with 3 more organizations next week, so that we can learn a little bit more about the social service agencies in, the community-based organizations that are providing services to our DHS recipients. So have a great rest of your day, everybody, and a good weekend. We'll talk to you next week.
Thank you.